Okay. Good morning, everyone. My name is Peter NYDIS, and I'm the Executive Director of New York Disaster Interface Services. And we are very happy to be hosting this call with you all, sponsored by USJCJ, and the New York Board of Rabbis. This is a webinar funded in partnership with the New York City Department of Health on their adapted pandemic toolkit for religious leaders in New York City. And we're grateful to the Health Department as well as the Fund for Public Health of New York City. Our facilitator this morning is going to be Helena Duran. Helena and her colleague Susan Polewski were responsible for this rewrite of the city's pandemic toolkit for community leaders, adapted for religious leaders, and this is the first in a series of 8 webinars for different faith communities in New York City. There's obviously a great deal going on. Preparedness might seem to be an odd topic during the middle of the pandemic, but the pandemic is, as you all know, evolving. There are now at least 3 identified new strains of the virus. The United States is having challenges with its vaccine supply, and we are many, many months away from any significant level of herd immunity, which would require about 80% of the population to be either vaccinated or have natural immunity for herd immunity to be achieved in the United States. So we're grateful that you're here to talk with us today about what congregations can do to continue to prepare for the many months ahead, and certainly recovery, but also future threats related to pandemic, and in this case, respiratory pandemic, which is always a threat. And if we just look back over the past 10 years, we can see we've had near misses with H5N1, H1N1, and the Ebola outbreak most recently. So this is an ever-present threat. Obviously, the current pandemic of COVID-19 is the first novel significant global pandemic in 100 years, but that doesn't mean they come every 100 years, as you are well aware. So thank you for joining us. I'm going to turn it over for a few words of welcome from Rabbi Janice on behalf of the Board of Rabbis, and then Helena will take us through the rest of the course. Rabbi.
Thank you, Peter. So as Peter said, I am a member of the Board of Governors for the New York Board of Rabbis, past president of Disaster Chaplaincy Services, Rabbi of Temple Sinai of Massapequa. Today, as Peter said, I'm representing the New York Board of Rabbis. I'm honored to be with everyone on the call today and any of the subsequent calls. We're grateful to co-sponsor, New York Board of Rabbis is grateful to co-sponsor this webinar in the toolkit with the United Synagogues of Conservative Judaism. And we, of course, extend a gratitude to all those attending today and subsequent meetings, and of course, those who will be implementing this toolkit. This is an extremely unique day in America. It is the very first full day of the new political administration. On this day, January 21st, literally 1 year ago, was the first COVID-19 case confirmation in the state of Washington. President Biden's very, very first executive order was to require masks on federal property, hoping to mitigate the CDC's projection of the death of more than 500,000 people in America by mid-February. While so many people watched the inauguration just yesterday of the new president, more than 2,500 people were dying in the United States of COVID, bringing our death toll to more than 406,200. Reading this week of the plague of darkness brought upon the Egyptians in this week's Torah portion, a midrash tells us that the Egyptians brought this plague upon themselves because of the society they created, the plague of darkness. With the issues facing our country, we believe, we know that the light is shining. Reb Zalman wrote, "A little bit of light dispels a lot of darkness." So with this toolkit and the strength of our country and community as reflected in this group and the subsequent 7 meetings for this toolkit, hopefully we are returning to the light. Thank you.
Thank you, Rabbi. All right, so we'll go ahead and dive into the content of the toolkit now. We've all had many Zoom meetings at this point, but you have video and audio control. Please mute when you're not speaking to avoid background noise. And if you're having any technical difficulties, you can send a message in the chat or email Susan, who's helping facilitate, at spolevsky@nydis.org. After this presentation, we'll send out an email with the information for an evaluation that we ask that you fill out. This helps us to see how the webinars are serving your community, and it also allows us to evaluate the program with the health department moving forward. And filling out that evaluation gives you access to the recording from today as well as the slides. All right, so my name is Helena Duran, and I will be walking us through the toolkit and what it contains and how it might be useful to you. So this is the overview for our plan today. Once we go through the toolkit content, we'll also have a vaccine update, and we'll have somebody from the health department joining the call to help with that. And we'll have a time for Q&A at the end of each section. So as Peter mentioned, this pandemic planning toolkit has been adapted for faith communities. And that means that we've included considerations for how your congregations have adapted your ritual and religious worship. And we've also taken into consideration information about your stakeholders and structures, what judicatory bodies might influence your procedures. And we also are adapting it to make sure that it serves you as you provide social services through your congregation. The toolkit also includes easy-to-use worksheets to adapt the recommendations for your congregation. So we hope that it brings together all of the useful information when you're writing your plan to make it as easy as possible for you and your leadership. So a quick overview of the important pages. I wonder if Susan is able to share a link to the toolkit in the chat so that people attending, you might be able to pull it up while we're working through it. But a quick overview of the important pages. Page 9 has the quick guide, which includes a checklist when you just get started writing your plan. Page 25, the planning guide begins, and that's where it begins to walk you through step-by-step in writing your plan. There are also template messages included for when you're providing risk communication to your congregants and to your leadership. And so those are included on page 71. And those also have strategic spots left blank for you to insert your specific synagogue or community centers information, but it also includes the COVID-19 language that the health department has been releasing. And there are also supplemental documents at the very end, which support you in writing that plan. And those are referenced throughout. So in the way that the pages are laid out in this toolkit, there are lots of different ways for you to engage with it. So we have gray boxes throughout the toolkit, and those share page numbers for where more information can be found about the topic that's being discussed on this page. There are lots of graphics to help aid in understanding the information that's provided and breaking it down. And then there are also blue boxes which tell you where to find template documents that your congregation can use while you're creating your own plan. And so that's the way to navigate this toolkit. All right, so in the toolkit, you start by describing your community, and it has you break down into two different groups. One group is your leadership and staff, and the other are your congregants and clients and contacts. And so you should identify these groups and who they are. And once they're identified, you can begin to plan around these two groups. So this will be the first step that the toolkit will walk you through. All right. And as you're describing your community, it also walks you through ways to map out this information. So it encourages you to create an organizational chart for your internal community or your leadership and your staff. And so we have examples throughout the toolkit that are shown here. And there are also on page 90, the chart for you to fill out is included in the toolkit. All right. So after you've mapped out who you're planning for, it has a whole section about planning your communications. And so you start by planning your communications for your leadership and staff. And it wants you to identify which types of communication are most appropriate. So it gives you a list of many bullet points to make sure that you're not leaving out any communications that might be important during a pandemic. So you're able to work through each of these in the toolkit and decide which you'd want to implement. I'm actually curious, now that we've gotten a few minutes in, we have a poll question for the people on the call. How many of you are working with an emergency plan currently? Is Susan able to share this poll question? All right, so I'm curious to see how many of you all are using a written plan during this pandemic. And this will also help as I'm presenting to figure out who my audience is and what might be most useful for you. All right, so I think we've got some responses. Great, I don't know if you're able to share the results, Susan, but I can read them out as well. A third of you are using a written emergency plan during the pandemic. 60% of you are not using one, and 15% of you have one in progress. So this is good information for me to know. And hopefully this toolkit will aid you in writing that plan and finishing that plan. All right, so we have the results up there. All right. So here we're back to the slide about planning communications for your leadership. And this is the information that you'd want to consider sharing with your leadership during a pandemic. The planning guide continues to talk about planning communications for your congregants, clients, and contacts. So this is kind of the more external facing communications. So it includes here in the bullet points the different types of information that you might want to share. And many of you have probably already shared this information as the pandemic started. And as it goes on, we want to make sure that you're including information about vaccine when it's available, and continued core 4 messaging that the health department likes to call it, of wearing a face covering, washing your hands, keeping your distance. And so this information, we hope you are already sending out. And as you're sending it out, we hope that you're following a plan to do it. All right. So when you're planning your communication, you also want to determine the method for how you want to communicate the information. So if you have a written plan, you're able to be strategic about where you're sharing your messaging and how it's most effective. So if you plan in advance, you'll know that within your leadership and staff, maybe it's email, and that's the way that best communicates, and that's the platform that best communicates the information you need for your leadership and staff. And for your congregants, clients, and contacts, maybe it's on social media, maybe it's your website, maybe you all have a newsletter, a pandemic newsletter that's going out. So these are all different platforms and methods that you might want to consider when you're sharing your information. There's also certain information that's shared best on a certain platform. So it's information specific. So if something is exceptionally urgent, you'll want to use a method that gets people attention the quickest. And so you'll want to go where you know the people are going already. So we have a poll question now. I'd like to know, what forms of communication have you utilized during the pandemic to share risk information? We have lots of options, so you can check all that apply. So what have you found works for you during this pandemic? All right, I see some answers coming in. We'll give it a minute, about a minute more. All right. Perfect. So it looks like email is the most utilized form of communication that we've used so far, which makes sense. We've got phone calls and phone trees. Excellent. Some people have website. There's less social media than I would have expected. 13% of you utilize social media for updates. And we have direct conversations. Excellent. All right. And flyers and posters as well. About a quarter of you are utilizing that. Excellent. All right. So here's an example of a supplemental document that can be found in the toolkit. So this will be towards the end of the toolkit around page 90. Here, this one is on page 92. So this is a template for writing a pandemic communication message. So at the top, we've got quick reminders about guiding you in writing your message. You want to consider your audience before you write the message, the purpose of the message, and your method of delivery. So writing an email message will be very different from writing what a radio release might be, something that might be read on the radio. And so once you've established those points, we have the 6 basic emergency message components listed out for you. And so it guides you through and just ensures that you're not forgetting any important information when you're sharing risk communication updates. All right. And this is an example of another supplemental document when you're planning your communications. So this one is also found on page 91. And so the toolkit kind of walks you through how you will communicate changes to worship services, any meal programs that you might have or social services, and information around the pandemic. And so these questions guide you through writing that message and making sure that you're not forgetting any vital information. There are also template messages, which I mentioned briefly in the toolkit. And these are form documents, and they have the basic content and leave certain information blank for you to fill in. So the template messages include getting ready for COVID, a message about if you're not feeling well, staying healthy during COVID, and any changes in congregational planning. So these are the 4 templates that are included. We are recommending sending out information about staying healthy, and if you're not feeling well currently, we know that there's a new strain of the virus currently in the US, and we know that it is more contagious, and so making sure that we're re-upping on our protections, making sure that we haven't gotten lax in our protections against the virus, and reminding people the importance of washing their hands and keeping distanced and good mask hygiene. All right, so once you've gotten through the communications portion of the toolkit, we start planning for continuity. And so we know that congregations are providing the services of spiritual care, celebrations, rituals, and ceremonies. And these are really important to a community in finding meaning, especially during a pandemic. And so we encourage that you plan ahead for how you'll maintain those as effectively as possible when your personnel might be less than you're used to, or when you're unable to gather in a physical space together. And so we know that you've spent a year now adapting your services, and you've made these plans. So if you're able to record what you've done thus far and what has worked for you and your congregation, you'll have it in writing for if a threat ever does reemerge that threatens you gathering in your structure or having less staff available to you. So part of continuity planning, there are these 3 functions that it walks you through. The first is identifying your synagogue or your community center's essential functions. So first you list down all of the functions that you provide to your community and as an institution, and then you identify which of those are essential during emergency that you want to continue and that you need to prioritize. The planning guide also teaches you how to write an orders of succession plan. So that means identifying which specific people or roles are in charge of completing those essential functions, and then who would succeed them if they were to become unavailable. And so making sure that you have people second and third in line during a pandemic is really important just because of illness. And then also it has you walking through your delegations of authority. So figuring out how that transfer of authority happens if somebody has to take over for somebody else. And making sure that that's written in advance to avoid any unnecessary confusion or effort putting in when you are responding to the pandemic. So here is an example of a page in the toolkit of identifying your congregation's functions and deciding if they're essential or non-essential. When we have taught this in the past, when we've taught continuity planning to congregations, many of them want to keep most or all of their functions as essential. And so we have to remind them in an emergency, when you're really pared down on staff or on space, what are the essential functions, the things that need to happen in emergency in order to support your community and also to support your institution. And one way to do that is to consider which of your functions pertain directly to your mission. So if your synagogue has a mission statement, this would be a good time to revisit it when you're planning out your functions to decide what ties directly to your mission and what's essential during an emergency. This is an example that's found in the toolkit of a house of worship, and it's kept general for the toolkit, but what is an example of a mission essential function for a congregation? So here they choose regular worship services. We also have you identify essential supporting activities. So those supporting activities that ensure that the essential function can be completed. So the supporting activity here was identifying as maintaining ritual items used for worship services. And then it also gives an example of what a congregation decided was their deferrable mission or non-essential function. And so this was providing religious education. So while it's important, and it might even tie to your mission statement, they decided that during an emergency, this would be deferrable. And there are supporting activities to those deferrable functions as well. So in the toolkit, it gives you examples of functions that might be considered essential. So your synagogue can look at this list and match it up and decide which of these are essential. And you might even be providing services outside of these bullet points as well that you will decide are essential. And then we also recognize that during pandemic and during emergencies, houses of worship provide disaster-specific services as well. And so some of those might be promoting coping and safe practices, maintaining disaster-specific personal self-care practices. We know that many of you have also recruited specially trained volunteers, especially if you've popped up any food distribution sites, or increased a specific type of social service in response to the needs in your community. And we also know that there might be some practicing reciprocity between faith communities, so maybe utilizing space and sharing space that's more ample and safer during this pandemic. And we especially know as well that you all have been communicating risk. And so these are all additional pandemic specific services that have been added to your essential functions. And I think that's where congregations have felt the strain during this pandemic, not only adapting the services they were already providing, but also adding in addition other services. All right, so after you've identified those essential functions, you'll create an order of succession chart. So on page 53, it teaches you how, and it gives you a template as well. So there are examples throughout the toolkit that you can look to and see how it might apply within your context. In this example for a congregation, it also includes not just the congregation function of providing sacred music during a ritual worship service, but also The chart continues on the second slide, but also their social service of preparing and feeding within their congregation. So this social service. And this is, of course, just an example page. We provide the chart to you and encourage you to create one for your own synagogue or community center. So we have another poll question to tie us in. I'm curious to know if your congregation has an order of succession plan. Delegation of authority usually comes after. If you have both, great, but I'll have Susan throw that question up. Do you all have a written order of succession plan? And so as a reminder, this is if somebody becomes unavailable, who would take their place? And I'm sure for some positions that are exceptionally important or contain a lot of authority, this has been thought through and hopefully written down. But we're curious to know if you have a written plan for all of your essential functions. All right. We have got 40% yes and about 60% no. Great. So I'm glad that some of us are thinking through having this in writing. And now is a great opportunity to put it in writing now that we know how things have kind of shaken out during the pandemic and what our institutions have deemed as essential. So we can go through and write that through. All right. So the continuity planning also accounts for a lot of the work that congregations are doing, like worship and religious gatherings. So there are strategies that are written throughout the toolkit to help aid in your planning, but it also brings to light certain limiting factors that you might face during a pandemic. So we know many of them now. And as vaccine distribution rolls out and as we continue responding to this pandemic, we encourage you to work through these. And also to make sure that at this point in the pandemic, that there's sustainability in the practices that you've adopted during the pandemic. And so I know that when it was first happening, I mean, this might be a simple example, but NYDIS got a Zoom account and we got certain limits put on and certain amount of licenses. And so looking into that and making sure that your software that you're using is still what you need, if you need to increase it or if you're able to pare back now that you know what the specific uses for specific platforms will be. And also in looking at sustainability, looking at when you're creating your delegations of authority, you'll see who or which positions in your congregation are bearing the load of many of the essential functions. And so part of sustainability is making sure that if you find that somebody really is overburdened or holds all of the authority in making sure that an essential function happens, that they're training somebody else to take over if they need a break or if they need somebody to aid them. And that's best practice. All right. So the toolkit also talks about ritual and religious considerations. So with diets, making sure that there are no impacts on supply chain during the pandemic that might impact diet. For spiritual care, knowing that you're providing care to a population that might be grieving or trying to make meaning during a pandemic. We know that you're increasing providing spiritual care to the sick, dying, and bereaved, and that you're also conducting potentially more funerals, memorials, and mourning rituals. And so this is another example of how a function that you would normally play or a function that you would normally serve, that your congregation is increasing responsibility there. All right. So once you've identified your essential functions and where you're seeing more pop up than before the pandemic, or that there are pandemic specific functions that your congregation is playing, we want you to maintain and adjust those essential functions and rituals. And so these bullet points walk you through a way that you can adjust and make sure that the functions that you're completing or that you're serving, that they are minimized where you can, and that your essential functions are maximizing where you need to spend your time in place. All right, so these continue onto a second page. And so these are all suggestions that you would be able to take into account when you're managing your essential functions. And again, this is something that we encourage a team sit down and plan so that your leadership come together. These are not decisions that a single person would be able to make. And we understand that there are different hierarchies within your faith tradition as well. And so making sure that you're incorporating the right people in the room and the key stakeholders at the time when these decisions are being made. All right, so we're curious in the chat to hear how your congregation has adjusted your services and rituals throughout the COVID-19 pandemic. And I know many adjustments have been made over the past year, and this is a place where we also get to hear about innovative practices. So how have you all adjusted your services in creative ways during COVID? I'll keep an eye on the chat, and I might have someone read out. There are a few question prompts as well. All right, I see one person is doing services via Zoom. Excellent. Religious services in person and Zoom. Yes, a lot of Zoom. Board meetings and Zoom, yes. I know some of us had to adjust how voting happened with the board, and making sure that we could utilize Zoom for that. Religious school on Zoom. This was one of the first things to pop up once people had kind of settled into the pandemic and taking care of their essential functions. They added religious school on Zoom pretty soon after. We heard that anecdotally through our other webinars. Yeah, bar bat mitzvahs mixed, but when in person, a limited number. Yeah, which is a really tough, it's a really tough thing to enforce. Having Shiva on Zoom, yeah. Yeah, limited to immediate family for bar and bat mitzvahs. Yep. So a lot of limited in-person gatherings and a lot of virtual gatherings. It sounds like we're making. Are any of you providing resources to your congregants to help them worship or practice rituals at home? Has there been any distribution of religious texts? I'm curious to hear.
Yes, I'm sorry. Okay, I unmuted myself, Rabbi David Altman. People have come to my porch and picked up prayer books. And so that's one way. I said, you don't have to come in the house if you wish. I'll leave them outdoors. And especially for the holidays, I did that and says, please just sign so I know who has them. And it'll be easier to provide the services on Zoom that I do. Although I put the pages up, it's not so easy sometimes to transfer. And my wife was helping me. Sometimes it takes a while. So if some people have the prayer book, it helps to continue the service. So that's what I've done.
Excellent, that's great. And I love that you made a sign out sheet as well. And so you're able to track the books that the prayer books that you're making available. Yes, I see attachments via email. Yeah, I know a lot of faith communities were trying to scan religious text, and send it out in advance. Excellent. All right, I see this in the chat. We've created a PDF of Shabbat worship. There we go. Excellent. All right, so we've all made adjustments during this pandemic, documenting them in a written plan, having these PDFs or scans saved together where you can access them at a future date if needed. This is all good practice moving forward. All right, so in planning for continuity, the toolkit also encourages you to think about supplies and equipment. So it encourages you to think about personal protective equipment, what you feel your congregation might be able to provide. It has you thinking about technology. I know that NYDIS, we're all working remotely, and so if your staff is working remotely, potentially providing them with laptops or computers, having telecommunication systems that work remotely. And also talking about hygiene supplies. I'm sure many of you have now a delineated budget item for the extra hygiene supplies that you've had to maintain in order to have people in your space, even in limited numbers. Okay. So the supplemental documents are listed here for which they are. And so you are able to see which ones we provide and how they'll help support in writing your plan. And we have time for Q&A. Are there any questions about the toolkit content that I just shared? Anything you foresee in being able to implement this type of information? We did share a link to the toolkit in the chat. If there are any questions that arise, you can go ahead and unmute or raise your hand and we can call on you. But I think unmuting is fine. I have a question for you all, out of our curiosity, if there's not any that come up, but which piece of the toolkit do you all think will be useful to implement for your specific synagogue or community center?
Well, what I would say is to have a order of succession. I didn't think of that. And I said, and I'm also older, and my wife helps me with services, and I didn't designate somebody, and I'm thinking of designating 2 people I immediately have in mind, that if I should become incapacitated, that they could kind of carry on Zoom, which I would like to happen. I thought about it, but never as seriously as I did now. So thank you for that.
Yeah, absolutely. All right. So we'll keep moving to the vaccine update now. I think we're on schedule. I'm looking towards Susan and Gabrielle to see if we're on time. And we'll go ahead and share what we know about the vaccine and share relevant information. And will you all let me know if Yeshi from the health department joins us? I'm curious, before we dive into the vaccine, was there any information that we didn't talk about that you were expecting when we talked about the toolkit? Sorry, I'll go ahead and go back. Did anybody have any needs that they felt weren't covered? I know we couldn't cover everything that was in the toolkit. It's 90 pages, but as it stands out now, was there anything you expected and didn't hear today? All right. And also in the evaluation, you're welcome to type that in as well. We have a 2-minute evaluation that we'll send out after this. All right, so for vaccine updates, what we know about what's happening in New York City. So we know that there are 2 COVID-19 vaccines, a Pfizer and a Moderna, that are approved for emergency use by the FDA. Both vaccines were more than 94% effective in their clinical trials at protecting from COVID-19. So these are the phases in New York City. And as of Monday, January 11th, we're in phase 1B. So these are the people who are currently eligible listed out. If you want to see the most up-to-date, we provide the link on the next slide to see if you are eligible. All right. So this is how to make an appointment, but we want to say that now we have heard last night that there are actually delays in vaccine distribution in New York City. And so the mayor gave a press conference last night about what exactly was causing the delays. But they are no longer taking new appointments. So you can't sign up for a new appointment currently. That is paused for now. And if you had an appointment for this week, they're postponing you to next week, pushing you a week back. And so this link is here, but we should know that we're currently not having new registrations for getting your vaccine. All right. So here is some vaccine information in New York City, the links that might be useful. And these links might also be useful to share with your congregants and with your leadership and staff, and sending out and making sure that people have the most up-to-date information about the vaccine. All right. Are there any questions about what's happening with the vaccine now? Actually, I'm going to pass it to Peter if there are any additional information about the vaccine that he wanted to share.
I have a comment, if I might, Rabbi David Altman. We've been trying all over. I'm over 75. My health is compromised. We haven't been able to get an appointment, but I did get one in Potsdam, New York, which is 6.5 hours away. My question would be, how do I make sure I have to call him? I'm going to drive 6.5 hours, may stay overnight, because there's nothing else to make sure that when I get there, they have enough of that vaccine. So I guess my suggestion would be to call them before I set out. But if I don't get anything else, I'm driving the 6.5 hours in the snow. I don't know, it's upstate New York. And I guess if I have to do that, but I really should get, I'm over 75, health compromised, and I can't. My wife is a New York State ombudsman. She has an appointment for January 27th, but she couldn't get one for me even. And I visit the nursing homes and so forth. So it's only a comment. Do whatever you have to do. That's what I suggest to people. And I am going to go on February the 4th, driving 6.5 hours if nothing else turns up.
Wow. Yeah, absolutely. That's a dedication. But I hope you're able to receive that vaccine and safely. If also 6.5 hours driving, if you're able to stay safely in a hotel.
Yeah, and that's it does snow up there.
Yeah.
Okay.
Making sure that we're reducing risk.
Thank you.
Yeah. All right. Are there any questions about vaccines we might be able to answer? We hope that this information you're able to share with your networks and get this information out, even with the pause that's happening on signing up to get your vaccine currently, that once it does become available again, that you're able to send this information out. Okay. And I do see that we have Rabbi Potasnik on the line. If you'd like to share any words. I believe we had you join.
Thank you so much. This has been really a very enlightening presentation. I just want to say very briefly that one of the things we've learned here at the board and working with Peter NYDIS and your organization and others as well, that the only way we're going to get through this safely is working with one another. There has to be a collaborative approach. None of us, no organization has all the answers, but together we can find, many of those answers. So thank you so much. And I think Rabbi Batisha spoke about bringing light. There's a lot of darkness out there and a lot of misinformation. So anything we can do to shed light and bring necessary, vital information to people, we say is a great mitzvah. So thank you for all you're doing. We look forward to working with you in the future. Great organization, NYDIS.
Thank you. All right. If that concludes any additional questions, we have some resources at the end of this slideshow. So first we'll send you an evaluation and a link in an email. We ask that you fill that out, and that will give you access to the slides from today and the webinar recording. And the slides from today, we also have additional resources, as Rabbi Potasnik shared, some information that might help putting in your hands. And so these are all linked in the slideshow, including the toolkit. The future webinars that we have for these toolkits for different faith groups. And we have one at the very end for religious leaders of any tradition. So if you found this useful and somebody might benefit from it, even within the Jewish community, they can join us then. So we have some resources here that I won't present, but you have them available at the end of the slideshow. And so we hope that you'll take a look and see if any of those are useful in supporting the work that we know that you're doing. So thank you for joining us today. I'll pass it off to Peter to sign us off.
Thank you, Helena and Susan. I also want to just take a quick opportunity to introduce Gabrielle Sclafani, who is our new program manager for the Faith Sector Community Preparedness Program. So she's taking the reins over from Helena. And I look forward to seeing the evaluations. But just to echo both rabbis, I think the light at the end of the tunnel is increasing. But we still have a long way to go, and we still have to remain vigilant and well-informed. When I spoke earlier about the fact that we have to achieve 80% of the population being vaccinated or having natural immunity to get to herd immunity, that is a significant task. Because almost 30% of the population questions whether or not they will receive the vaccination. Some of that is out of is because they reject vaccines for a variety of reasons, but part of that is trust, that people aren't sure whether or not they trust the vaccine. And it's critical to communities of faith, and particularly for the vulnerable who we serve, that we are able to disseminate accurate information on the vaccine. There's a lot of fear about allergic reactions and side effects that, for the most part, are not significant. And even in the large group studies, very small numbers of people have significant side effects. And most of them are what you would anticipate, of course, headaches and slight fever and things like that. So it is our goal to make sure the congregations in New York City and faith-based nonprofits have accurate information to support leadership and decision-making, but also that we work through trusted community leaders like rabbis and the leadership in your congregations to make sure that people have accurate information on the vaccine. So I hope that you, when you do get the vaccine, and I hope that you will, that you'll share your experience of the vaccine with your congregations to help them understand that people that they know and trust have had it, what their reactions may have been. It will help normalize the experience of getting the vaccine. Rabbi Potasnik and I are frequently on phone calls with the governor's office and other leaders of religious networks in the state. And the other side of that is the conversations about equity and justice, making sure that the most vulnerable communities in New York State get the vaccine first. That doesn't mean that anybody who is health vulnerable shouldn't get it, waiting for someone else. I'm saying for those folks that are healthy and able, for them to make sure, and for us as faith leaders to make sure that we know that the vaccine is getting to the communities and populations that are most vulnerable. And there's controversy, of course, in who gets the vaccine. Currently, there's a lot of upset that it's not getting into the prison population, which is congregant housing. through a lot of advocacy, homeless shelters and homeless shelter workers were added to the 1B list. So if you have concerns or questions about who is on what list, please feel free to share that with Rabbi Potasnik or me or any one of us that you feel like can get that message back to the governor's office. But there is the opportunity to continue advocacy when we discover vulnerable populations are not being properly prioritized or vaccinated. But I hope this was a helpful webinar. I hope you'll join me in praying for the wisdom of our new political administration and their vaccine planning, because our lives literally depend on the effectiveness of the Biden administration's vaccine planning and access in a timely manner to the vaccine for the American people. So again, thank you for your interest in today's webinar. Thanks for joining us. Thank you so much to our co-sponsors. And as always, thanks to my staff for doing great work and being so dedicated to this effort. Bye, everybody.